We begin with the latest on the pandemic. While nearly every U.S. county is still reporting high transmission, nationwide the number of new daily COVID cases is actually down about 5% in the last week.
But daily deaths now stand at nearly 1,750 nationwide, with the number of fatalities projected to increase over the next 4 weeks.
The CDC is pointing to 3 new studies highlighting the protection provided by getting vaccinated and boosted. ABC's Zareen Shaw is in California with the story. Good morning to you, Zareen.
Good morning, Eva. Less than half of people eligible for the booster have gotten it. Now there's new research on that extra shot, and it shows that your chances of staying out of the hospital and living are dramatically higher if you have that booster. This morning, a promising CDC study showing the strength of boosters. The study confirming a third shot cuts the risk of landing in the ER or urgent care by 94% when it comes to the Delta variant and 82% for Omicron. Another study showing if you are completely unvaccinated, you're 14 times more likely to be infected and 53 times more likely to die compared to people who are boosted.
Second, protection against infection and hospitalization with the Omicron variant is highest for those who are up to date with their vaccination, meaning those who are boosted when they are eligible.
But many of those eligible still haven't gotten the vaccine. The U.S. recording over 18 million new cases in the last month alone, more than a quarter of the nation's total number of confirmed COVID-19 cases reported since the beginning of the pandemic. With COVID-19 tests still in short supply, testing processing labs like this one in North Carolina slammed trying to meet demands.
We've seen large increase in the amount of samples, large increase in the amount of positivity among those samples. So it's been all hands on deck.
But some places like San Francisco are starting to plateau when it comes to cases.
The light at the end of the tunnel is here.
Nationwide, a 10% decrease in cases. The CDC acknowledging that drop while also issuing a stark warning.
Let me just say, cases are coming down. We still are at extraordinarily high levels of disease.
In Wisconsin, hospitals overrun.
We're finding we've had to put patients sitting on a cot in the hallway in a perfectly public space just because there was nowhere else to go. Everybody's exhausted.
Exhausted, with many states still dealing with a surge. In southern Arizona, the National Guard has stepped in. They say if they were not there, nurses would manage, but the level of care would go down at that point.
Yeah, we're seeing those resources strained. Zareen, thank you. For more now, we're joined by ABC News contributor Dr. John Brownstein, also Chief Innovation Officer at Boston Children's Hospital. Dr. Brownstein, good morning. It's always good to have you. So we're learning a lot from these 3 new CDC studies about vaccines and booster shots and how they hold up against Omicron. What's your biggest takeaway here?
Well, thanks, Whit. Thanks for having me on. Overall, these studies reaffirm what we already know about the vaccines. They provide incredible protection against severe illness and death, and that still stays with us with Omicron. And that's especially true if you're up to date with your vaccine and boosted. And so these boosters are dramatically reducing your risk of ED visits, hospitalizations, and death. And even if people see these breakthrough infections among vaccinated, those are mostly asymptomatic or mild. So the impact really is in our unvaccinated population with far more cases, severe illness, and death.
So we're talking about all this evidence here, the importance of booster shots, and yet 86 million eligible Americans still haven't gotten them, less than 50% who are eligible. Do you worry about this perception of an ongoing cycle here with a potential 4th shot, talk of boosters every year? We don't know what's going to happen, but how do you convince people that they shouldn't wait on booster shots?
I get it. We see this sort of shot after shot and people are wondering whether, it's even worth it. But that's not too different from what we deal with flu. Flu is evolving and we have to get a shot every year to keep up with that. And, we just have to keep looking at the data. Unvaccinated are nearly 4 times more likely to be infected and 53 times more likely to die. That is huge numbers. So we just have to keep educating people, meeting them where they are, and really explaining the benefits of these vaccines.
Turning to another subject here, health officials in the UK are now investigating a new subvariant of Omicron. It's not been labeled a variant of concern, but what do we need to keep in mind as these new variants pop up, and we know that they will in the coming months?
This is true. When you have this much intense transmission, and Omicron's the most transmissible variant yet, we are going to see evolution of the virus. And this is happening right now. Omicron is dominant, and we will see these sublineages. And this is why it's so important to do genomic surveillance. There's no indication yet that this new sublineage is any more severe, but we still have to focus on it. And this makes the case for why we need to vaccinate the billions of people that have yet to access the vaccines. When you don't have vaccines available to many people, that's what creates pressure and creates these new variants that we have to deal with.
We're seeing cases start to drop in some parts of the country, but hospitals still crushed in other areas. Do you see hope on the horizon here? Are we nearing the end of this Omicron surge?
I do see hope, and you're starting to see cases turn. But remember, the early places that had the surge, like New York, they're seeing that downturn. But now you see the virus, as we've seen in previous waves, move out into suburban and rural areas. So there are many parts of this country that have yet to see that surge. I'm still worried that you're going to have a lot of cases on the downturn, and you'll have pressure on a hospital. So we just have a few more weeks to deal with this Omicron surge. So now is really not the time to let our guard down. But I do expect the coming months to be much more calm than what we're experiencing right now.
And as you noted, they're coming down from the peak can still be very difficult for a lot of people. Dr. Brownstein, thank you so much. As always, we appreciate it.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.